Very interesting, Bharat. I think I'll give you a different perspective to the audience and Divleen to you. When you look at any tech, where it came in, today it's AI. I think technology adoption is not about using AI. It's about change management. Every organization, and today when I speak of it, you look at it, hospital. I'm sure hospitals in India have adopted to hospital information systems, which brings in a lot of data, but that is billing data. Is it relevant to give care coordination and better enterprise? Maybe not. But I think the way we have captured data and make it more meaningful, a relevance to you to be able to predict, bring in more logical decision making, and then being it more AI ready, I think there's a gap. So I think when you talk of the barrier, one of the biggest barriers is amiable, accessible, relevant data sets. So which is what I think Abhishek and Sridhar put very rightly, that anything which is atom can be a little bit of shaky thing in terms of putting it. So if we can try to solve that piece in the machine readable bits, that eases it out. And I think that's the way forward to move. The second is, if you look at organizations, accessing and implementing, they should do it in 3 levels. One is tactical, strategic, and future, which is what moonshot he says. The moonshot would be, you get into a hospital and you're detected, you're detected, you know what your past problems are, and you can see, and then you can directly into the right relevant chamber. Same in the ER, that is moonshot. But if you look off today, tactically, I think if I can detect or assimilate the data sets that are required for me to comprehend the best accessible data for a clinician to give right decision making, that is the tactical data set that we are talking. So I think from the barrier standpoint, there are 2 things. One is a good data set which is accessible, and second is the challenges, the implementation challenges internally to the org. I'm sure we have talked about regulations at different levels. There's a need at India, a national level, a state level. Some of the good regulations that have come by are, if you look at the Colorado has done a very good job in the United States, and of course the European Union. So the high risk tensed AI-based models have been restricted. They need to be implemented in-person protocols, et cetera, et cetera. So those need to be, again, taken in well consideration while creating all these implementation challenges.
That's really insightful. Thank you so much. I will wrap up the session. Sorry, no, please. Finish your thought.
Just adding to what you said, I mean, how about we basically look at making our health system a continuous loop so that we close it, right? So think about it. With every visit of a patient, our system gets smarter, which is AI can turn hospitals basically into adaptive learning. That's when I talked about that urban-rural. When you combine that fabric, it becomes that adaptive learning, so that before you come in, your past history, your lab reports and things like that. I think this will be a foundation for this thing called Ayushman Bharat Digital Mission, laying the foundation. So that's where I see, if we can make that as a digital adaptive learning with AI, we can use that in Ayushman basically to get that foundation in. So with that, I'll close. I'll say, what I see is, in best case, if we do this, India becomes a global model for equitable, AI-enabled health delivery, with that adaptive learning and using what the government is pushing down.
Oh, thank you so much. Dr. Shilpi, closing remarks.
I think throughout the day, we have touched upon numerous aspects on AI, and I think the key things that emerged as one theme was there are a lot of use cases that are already there, but we have to really make it happen, and along with change management, adoption, support from the right stakeholders, this 5 years from now, we'll be having a very different discussion. So that's the hope. Thank you.
Thank you. Shishir, closing remarks?
I think my colleagues summarized very well. The day we are able to do, like we are doing the digital payment with NPCI, Phone Pay, Google Pay, the way we are able to exchange our electronic document summaries the same way, I think that's the way we have achieved the AI for all initiative and being more equitable, bringing and democratizing AI to the public level. That's the vision.
Thank you so much. I'm going to let everyone go. Thank you so much, our esteemed panelists. This has been a great session.